Today, we're going to hear about how a chain of urgent care centers in Israel functions both in peacetime and in wartime. We have with us Hannan Kranc, who's the director of Terem's southern region. Welcome, Hanan.
Hi, thank you. So nice to be here.
Good. So Hanan and I know each other for a long time. His parents are good friends of mine, and he's done amazing work. And I wanted to share it with people in Israel and abroad. Hanan, please tell them a little bit more about your current role and also what your pathway, how you came to be in that role.
Sure. Thanks again for having me. So, as you said, we know each other for many years. I grew up in Jerusalem, not too far from you. And throughout the last 20 years, give or take, I've been involved in emergency medicine and urgent care through Magen David Adom and the EMS. And then later on, also through the IDF and in Terem. After the IDF, I studied a bachelor in emergency medicine in Ben Gurion University, where I actually teach now as part of the faculty as well of the emergency medicine department. In addition, I later on continued to a Master of Public Health as well in Ben Gurion University of the Negev, where I also researched issues that have to do with particulate matter and air pollution and how they affect urgent medical situations. I finished recently another master's degree in legal studies, and as I said, I still am involved also in MADA as an EMS volunteer. And over the years, I've been involved for the last 12 years, give or take, in Terem. I started as a paramedic in the Jerusalem clinics, and then as I moved south and the organization was actually expanding and opening southern branches, I got involved higher and more deeper in the organization. And now I'm the director of the southern region, as you said.
That's terrific. How many clinics do you have in the southern region?
I am in charge directly of 5 clinics,
Wow.
from Kiryat Gat and Sderot via Beersheva, Mitzpe Ramon, which is a very small boutique clinic, and Eilat, which is Israel's southern tip.
Wow. Must entail a lot of traveling. Tell us first of all about Terem in peacetime, how it fits into the broader system, what's special about it. And after you talk about that, I'll ask you some questions about what its role was during the recent war.
Sure. So Terem is originally a Jerusalem-based chain with over 30 years of experience in the urgent care field, originally founded by Dr. David Applebaum, who was the manager of the Shire Tzedek Hospital Emergency Department. And he basically understood that there's a issue that actually is going on kind of worldwide, where you have the emergency departments overcrowded, so that things that are simple and could have been treated outpatiently without coming into the hospital are taking way too long, and the complicated cases inside the hospital aren't getting the right attention because the hospital is overcrowded with the simple cases. So his idea was basically to take the simpler cases that can be treated ambulatory outside of the hospital and treat them in the self-standing urgent care center. So it started originally in 1989 in Jerusalem and later on expanded little by little to the Jerusalem region. Now has over 30 clinics nationwide, from Katsarin in the north until a lot in the south, like I said. And basically we see in Terem all kinds of urgent care ambulatory cases. For example, literally from kids that are a few days old with any medical issue, feeding issues, fever, dehydration, via minor traumas like contusions or lacerations or even fractures, and go on till chest pain on the older age and older people that need to rule out severe diagnoses.
Very important and very clear. So now tell us a little bit about Terem during this recent war.
So I'll start from my personal perspective. On October 7th, I was at home. I was woken up, as were most of the people in this country. And beyond, I still have a position in the IDF as a reserve soldier. So between the calls from the reserves trying to figure out whether I need to go in and when, I understood that we have issues inside our clinics. We had on October 7th our Sderot clinic, which, as I said, I am in charge of. Our Sderot clinic, we had staff there that was there. They were about to lock up the clinic at 6:30 a.m. when they understood that something was going on, and actually a patient's son ran in and said that there are people outside and there's something going on. So they all locked themselves inside the safe room inside Sderot, inside the clinic, and they were locked there for the next 12 hours. And only on Saturday night, 12 hours later, did the police escort them out of the city. The patient, her son, a Arab Muslim doctor, and a Jewish paramedic all locked together for 12 hours. Obviously, by surprise, none of them had any of this planned in any way. It was definitely the whole day I was with phone calls with them. Are they okay? Do they have everything? Have they been getting able to get a hold of water even? Like, because none of this was expected.
Sure.
And then as the state got into the status of a long-term war, not just the surprise of that morning, we changed our direction and we started dealing with understanding where we're most needed. So we, in a lot, and because they're generally peripheral areas, and a lot of the people from the Gaza area were brought there because their houses were attacked or considered unsafe. So made our hours wider. We opened for more hours during the day, and we also understood that there's areas that usually there aren't the same amount of people, and the clinics nearby can't manage the amount of patients that are there. So we opened a few more clinics. For example, the Dead Sea Hotels, which on a regular basis is about a 20-minute drive from the Arad clinics or a 45-minute drive from Beersheba. So we opened a new clinic temporarily inside the hotels. So that was the way that we addressed it, and we also added hours in different clinics that we understood that some of the the CMO, the HMOs are unable to work because the area is under attack or because their manpower. Many of them staff for us and for the whole medical field were drafted. So we needed to figure out how we work with this and how we work together with the community to find where we're most needed and what the best solution is for every location.
Sounds like you managed it really well. And it sounds like you and your organization and your staff made a truly important contribution during the war, which is above and beyond the contribution that you make to Israeli healthcare and to the people of Israel on a day-to-day basis, even in peacetime. So, Hanan, before we wrap up, do you have any parting sentences or words you'd like to leave us with?
I'd like to state that, as I mentioned throughout the Sderot story, we have a staff that's always built, and we always have staff from all parts of the Israeli society: Jews, Arabs, Christians, Muslims, all religions. And it helps us get a wider perspective when we're treating patients coming in from every part of the Israeli population. And I think that in the Israeli healthcare, it's a interesting phenomena that we have so many people working together, and with our sole goal being saving lives and providing great healthcare nationwide. And therefore we work together in places that it's something that you don't really see as much in other parts of the Israeli society.
Crance, thank you very much.
Thank you for having me.